So you've been through your first appointment with your urologist or your urogynecologist, and they give you the word, hello, Jill, you've got tight pelvic floor muscles. It's time to go to physical therapy. Understand that tight pelvic floor muscles have a long-term devastating consequence to the pelvis because interwoven among those pelvic floor muscles are blood vessels and nerves. And so when you have tight pelvic muscles, what does that do? Ooh, that starts squeezing blood vessels. That starts squeezing nerves. And if your bladder is supposed to get 24 units of blood a day and it's only getting 10, are you going to have a healthy bladder wall? No. Our therapeutic priority for patients with tight pelvic floor muscles is to restore blood supply. And the way that we restore blood supply is by getting these muscles healthy. So you will first be sent to a pelvic floor physical therapist. Now listen, if you go to a physical therapist and they tell you to do a Kegel, they're not trained. Because Kegel exercises are not suggested for somebody with tight pelvic floor muscles. Kegel exercises are suggested for people with weak muscles. If you're incontinent, yes, they might have you do Kegels, but if you've got hypertonic tight muscles, the last thing you want to do is a Kegel because the odds are it's going to hurt. Instead, we're going to focus on relaxing that muscle. So they will send you or refer you to a trained pelvic floor physical therapist. There's a wonderful database online called pelvicrehab.com, pelvicrehab.com. You can search that by zip code to find trained physical therapists in your area. And at that very first appointment, what they're going to do is do a pelvic floor assessment. This is a new set of eyes studying your muscles, studying your pelvic structures to see if we can try to understand what's going on and why you might be in so much pain and discomfort. Please remember that tight pelvic floor muscles can cause frequency, urgency, pressure, pain. I can remember a gentleman I was working with who had very clear pelvic floor symptoms, but he was peeing a lot, and he's like, Jill, it's my bladder, and he got really angry at me. Well, to make a very long story short, months later, he finally got a muscle assessment, and bam, he had a massive muscle injury. So getting back to your first appointment, just wear comfortable clothes, just wear your workout clothes, no big deal. Don't worry, there's nothing to worry about with this appointment. When you get there, the first thing they're going to do is just study your body. They're going to have you walk up and down a hallway. Let's see if you're walking normally. They're going to look for tension patterns in your legs, in your thighs, in your lower back, in your hips, in your core. And your ability to describe your symptoms gives them a roadmap. And so before you go to that appointment, I want you to just make a list of your symptoms. Can you urinate on command, or do you hesitate 5, 10, 15, 20 seconds? Do you ever have pain that shoots down your leg? Do you ever have pain by your tailbone? Do you have pain when you sit down that gets better when you stand up? Your ability to describe your symptoms will help that physical therapist immensely study your body and basically know where to look. So tell them everything. That one random once in a blue moon symptom where you feel this painful arousal sensation, tell them about that. Because what that means is that you've got a muscle squeezing a nerve. Or do you ever have sciatica? Or do you ever have pain in your hip, pain in your tailbone? Also, make sure you tell them about any past traumas. Were you an athlete? Were you a paratrooper? Have you fallen on your tailbone? Have you fallen downstairs? You'd be amazed at the number of patients who have fallen downstairs. I find it quite interesting. A lot of tailbone injuries out there in that typical IC patient population. So they will also measure your legs. We want to see, do you have one leg longer than the other? As an example, I was working with a patient who, as a child, had suffered a very severe broken leg. And now that they were an adult, they had one leg that was like a half an inch longer than the other. The broken leg was shorter. And that tilted their pelvis, which created long-term pelvic pain. So measuring your legs is important. I use a little tiny 1/4 inch lift in my right foot because my right leg is about 1/4 inch shorter than my left. So that little 1/4 inch pad that I use in my tennis shoes, gold, really, really helps me. Now, once they finish the external exam, they're going to do an internal exam. And this is the single most important part of the exam. Don't be afraid of it. It's not weird. You're not going to be in stirrups. Basically, you're going to be laying on a table with your knees up. They're going to have a glove, a little bit of KY, and they're going to go right in and touch muscle. That's their job. They're going to touch shallow muscle. They're going to touch deep muscle. But deep is relative. It's like this long, right? No biggie. If they can touch a muscle and trigger your pain, that is what I call your hallelujah moment. Oh my God, that's it. What are you touching? Don't be afraid of pain at that first appointment. If they can touch it and trigger pain, that is super exciting because they found it. And again, your question is, that's it. What are you touching? I want you to walk out of that appointment with the names of the muscles. Is it your obturator? Is it your piriformis? Is it your levator ani? Our goal here is to try to identify the structure causing your pain. And normally at that first appointment, the physical therapist will then give you some gentle exercises to do to start rehabilitating that muscle. Sometimes muscles are tight. Sometimes, like for me, when I had my first pelvic floor assessment, my shallow muscles, my levator ani muscles were super, super tight because they were compensating for very, very weak muscles higher up by my piriformis. And so sometimes it can be on the left side, sometimes it can be on the right side. So let's see what that pelvic floor physical therapist can find when they study your muscles. Now, I want you to understand that for many of us, myself included, this has been going on for a long time. And 3 physical therapy appointments is not going to fix this. You're going to be in physical therapy for a good period of time, 6 months, 9 months maybe. Because we have got to retrain these muscles and teach these muscles how to relax. And the great news is we have a really good multi-center clinical trial which has proven that pelvic floor physical therapy is far more effective at reducing the symptoms of IC than an oral therapy. So the research shows that it works. I can tell you it completely changed my life. And it's why I don't have bladder, bowel, vulva symptoms anymore. I've got my muscles healthy again. Now, some of you may be very reluctant to do physical therapy because you are a victim of abuse. You don't want anybody touching you down there, and I really understand that. And I'm so, so sorry that that happened to you. If you are in this group, when you go to physical therapy, tell your physical therapist that you're very uncomfortable. Because ultimately, in the end, this is about trust. And you might not be able to trust them the first time. You might not be able to trust them for 6 or 7 or 8 times. But what we want to do, and they're not going to push it, they will start externally because they want you to see that working with muscles will make you better, and more importantly, that they're very gentle, very reliable, and that you can trust them. Our goal here is to try to get to that point when you can do some internal work, because it's that internal myofascial massage that is the most successful. Now, once you've gone through this and you've had physical therapy, they may encourage you to start using a wand. I use a wand. As soon as I feel my muscles getting tight, and I can tell that by how I urinate. If I'm hesitating urinating, I know my muscles are tight. I can get out my wand, drop trowel, go into my bedroom, and use my internal wand to massage my muscles myself. And it takes 3 or 4 minutes to calm that muscle down. A healthy muscle feels like a raw chicken breast. A tight muscle feels like painful beef jerky. And in the end, our goal for you is to give you that independence so that you're not dependent on somebody to help you get out of the flare. Or, if we can catch this flare early, get this muscle relaxed before it locks down tight, that will serve you well. So anyway, don't be afraid of physical therapy. It has been remarkably helpful. It has changed many, many lives. The research proves it. Yes, it's a little awkward at first. Yes, having that internal massage is a little strange at first, but it's helped so many patients get better, and I am one of them. You can learn a lot more about physical therapy over on our website, the IC Network. We also have some fabulous, fabulous books. Let me get one here real quick. If you are a trauma patient, if you've sustained very severe injuries, if you've had tailbone injuries, hip injuries, or, one of the questions you want to ask your physical therapist as you're doing therapy is, are my muscles slowly getting better, or are they always locking back down into tension? If they're always locking back down into tension, then we've got to look at what puts long-term stress on muscles, which is bones. Do we have a broken tailbone? Do we have a tailbone that's out of position? Do we have a bad hip? Do we have a bad knee? I happen to have a bad SI joint on my left side. My SI joint's very flexible, so my muscles always lock down tight to hold it in place. But for many patients, their long-term pelvic floor tension actually is about how they walk. They're not walking normally. They might have an ankle rolling in, an ankle rolling out. They might be pigeon-toed, duck-footed. So if you have any history of trauma, or you're one of those patients where your muscles always get tight, this is the book to get. This is called Breaking Through Chronic Pelvic Pain by Dr. Jerome Weiss. This book is insanely good. It is a master class in pelvic anatomy because I want you to be able to visualize the names of the muscles and where that physical therapist is touching when they're working on you. You got to know this stuff. And most importantly, it is filled with incredible success stories. It will absolutely connect the dots between bike injuries, tailbone injuries, all that sort of stuff with your bladder symptoms, and it will give you a clear path to treatment. So please think about getting the book, Breaking Through Chronic Pelvic Pain. You can find it on the IC Network shop. It's $29, worth every single penny of it. You can get it on Amazon on $36, but this is a life-changing book, and it's beautifully written. All right? So again, if you're looking for any more information, come on over to the IC Network website.